Senator Cantwell.
Thank you, Thank you, Mr. Chairman. I apologize for not being here right at the reconvening of the committee, and I do want to speak in support of Senator Rockefeller's public option amendment, but I would like to ask Ms. Fontenot a question first, which is, we've had a lot of discussion here about Medicare and Medicare rates as it relates to the way the amendment is drafted, and it's my understanding that Senator Rockefeller's amendment says that you would pay Medicare rates based on current law, and in the underlying bill, assuming that both Senator Rockefeller's amendment was adopted and the bill as it's currently in the modification would be adopted, that Medicare rates would be very different than they are today, and that Senator Conrad's concern that providers in his state might not be getting an adequate reimbursement would be changed under this formula. Is that correct?
It's correct that under the Senator's amendment, the public option would pay based on the current Medicare reimbursement rates, which are dramatically changed in this bill. So it would reflect the policy changes that we're considering.
And so if you were from an efficient state that had efficient, low-cost delivery system but good outcome, you'd actually be making more than you are currently today. So if you were from a state like Senator Conrad's, chances are you'd be making more money and it wouldn't be as an exacerbated problem as it is today. Is that correct?
Correct.
Which I think is an important point, because the underlying bill is making a fundamental policy shift in the way we pay for Medicare services, not just in Medicare Advantage, but in accountable care organizations, and saying that we're going to have global budgeting and that organizations are going to move to global budgeting and that they're going to reap the benefits from being efficient care providers and sharing in some of the profit. The value index that I proposed that was adopted by the chairman also says that you're going to pay based on the quality of outcome, which means that if you're better than the national average in delivering care and quality, you're going to get paid more and you're going to get incentives. So I actually think that that is an important part to the debate about Senator Rockefeller's amendment and the public option in Medicare. But, Mr. Chairman, my fundamental view about this is about market competition, and it is about market forces. And I certainly believe, as I look at this bill, we're spending, at least half the money. Some of the money is going to Medicaid expansion, but $483 billion is going to tax subsidies to basically buy insurance that's expensive insurance, and I'd like to see more competition to that. I'd like to see more competition in the marketplace, and I think one of the providers of that competition can be the federal government. Now, why do I want to see that competition? Well, frankly, as this chart shows, where we've been in America, we have been at a point where wages have only gone up 29%, the insurance premiums have gone up 120%, and we've seen insurance profits go up 428%. Insurance profits went up 428% in a 10-year period of time, where we know where the money came from. It came from an increase in insurance premiums. Now, that's Robert Wood Johnson Foundation information. And so the fact that they have had these extraordinary profits in a short period of time has gotten many people in Washington State and many people across the country asking a fundamental question, which is, what are we going to do to restore competition in the marketplace so that somebody isn't just walking away with a store here? And my constituents who look at things and say, geez, I don't know what you guys are doing, but oil numbers went through the roof on future derivatives, and what did you do about that because I got gouged there? They want to know what we're doing about banks who went crazy on credit default swaps and then basically got a bailout, and what are you doing for me because last I checked, I can't even get, they're saying they're having problems with their own banking. Credit card companies are now, even though we supposedly passed a law, are running away with, having made money off this situation and now gouging consumers with higher interest premiums and rechanging. So, to say nothing of the drug companies, which we all said we were going to debate this issue as it related to Part D, what do we do? Instead of having clout in the marketplace with Medicare, we ended up with going to the private sector and saying we're going to drive down the price of prescription drugs. Well, I would ask anybody to look at the price of prescription drugs in the last couple of years, and we haven't driven them down. So to me, the key point here is, are we going to stand with the public and use the bulk purchasing power of the public to drive down the cost of health care. And so I support a public option to do that. I support a public option that will drive down the cost by using that power in the marketplace to be an alternative to the private sector. Now, I know that, we'll have a chance to talk about other amendments, and I'd certainly support other amendments and plan on offering one myself that would allow the private sector to participate through the negotiations, similar to what Senator Conrad was saying, of using non-for-profits as a tool to drive down the cost and have them use the clout of the government to help drive down that cost. But that'll be another debate. And this debate is really about whether we are going to have the kind of competition that will help us with this very, very consolidated market of 94% consolidation, and the fact that people have very few choices. Now, we've heard a lot of discussion about, well, isn't this going to be, isn't this going to be cost shifting? Isn't this going to cause problems, in the marketplace? Well, CMS, as it does today, and working with the medical community, is going to have to pay a rate, if this came into play, would have to pay a rate that's going to attract physicians to cover and carry this market. And that'll be a fundamental part of the legislation, just as accountable care organizations and the value index is, and providing care. But if we do nothing, and the rates go up another 120% in the private sector, which is what the plan is basically that everybody agrees is going to happen if we do nothing, it's going to be an unacceptable outcome to the American people. So I hope my colleagues will stand on the side of competition, but on the side of competition of letting the American people, Costco is a great store in Washington State. I know many people, my colleagues here, they love to tell me about how they go to Costco and they buy something. Well, they go to Costco and they buy something because somebody has bought that product in bulk and has driven down the price for them. And they've driven down the price because they have been able to buy in large volume. That's what the American people want. They want us to stand on their side, drive down the price by buying in bulk, and compete with this unrelenting increase in rates that they have seen. So, Mr. Chairman, I support Senator Rockefeller, I will support Senator Schumer, and I will continue to offer my own amendments to make sure that we continue this effort to give the consumers that kind of competition in the marketplace. I thank the Chair.
Thank you. Senator Crapo.